Welcome and congrats! You have found the MMAC Minute podcast, where Shar, RN and owner, and Mallory, NP and Medical Director of Montana Medical Aesthetics Clinic, hence the MMAC, take a little dive into the world of aesthetics. Join us as we discuss hot topics and timeless truths. We will be your guides to navigating your own aesthetic journey.
Okay. Hey, welcome.
We have a special guest for you today. Many of you know and all of you love
Joelle, Jonelle, Joella, Jolyle,
Joellen,
Jolie.
She could,
Yeah.
the woman
I'll
with many
answer to
names.
anything.
Yeah.
I've been called worse, I'm sure.
Yeah. Or she
I called you
deserves to
worse.
be called worse. If she hasn't, she deserves to be called worse. So yeah, we have a special guest today. But first,
Stop what you're doing.
we
Listen up.
often say it's been a while, but we really mean this time it's been a while.
Probably
we
most
really,
of my
yeah. No, it's just life, right?
Yeah.
So we're back at it. We just have to schedule it in, and we're going to schedule it in because we love doing this.
Yeah, we do. It's
So welcome back to our channel and
Welcome.
our little YouTube podcast. Please,
Like,
if you like it and love it and like us,
give us a thumbs up.
and please subscribe.
And if you want to leave a comment, I really appreciate those. I like to read them. I will respond to you. I'll say thank you.
Yeah.
I'll send you a hug.
It just helps with getting the video out
Yeah.
to other people and that kind of thing. So it's really fun. It's really fun. So we'll try to make it as we try to keep it brief-ish so it doesn't take up your entire afternoon.
I was just going to say, see, Joel, this
um,
is why it takes us 40 minutes when
uh-huh.
we say it's going to be
Yeah.
50.
So yeah. So today, this
Like,
is
how
this
long?
is one of the specials during the month of March is going to be laser hair removal. That's why we have our special guest today, because she knows anything and everything that anybody would like to know about laser hair removal, has truly more experience than anybody in the city of Billings or surrounding area,
Yeah.
has done every body type, every body part, both men and women. So we've got some great questions for her. And full disclosure, she's nervous, so she'll loosen up.
That
We
probably
know.
helped. Now you're not nervous, right?
No,
No.
that helped a
Yeah.
lot.
Yeah. So how many years have you been doing laser hair removal?
17, right?
Yeah.
17?
17, the end of
2008?
March. Yeah.
Yeah.
Yeah. So
How is that
that's a lot.
possible? You look 25.
Oh, yes.
And so was there special education?
I've been a certified laser tech since 2010. I received my certification from American Society for Laser Medicine and Surgery.
And what did you do before coming to work with lasers?
I worked in labor and delivery for 16 years. And then
And what did you do there?
I was like a surgical tech, patient care tech.
In emergency situations and non-emergency situations, and with, high stress kind of, yeah. So she, and she's kind of our resident fix-it person too. So yeah.
Joe.
So-
Handy Joe.
Joe.
So when we talk about laser hair removal, who is a candidate for laser hair removal?
Well, someone without sun exposure or added color to their skin. We can do most any skin type with the proper laser. So there's certain lasers that you have to do the darker skin tones. But so someone with dark hair, blonde hairs doesn't really work well. Grays, reds, they just really don't respond to.
And why don't they?
Because the lasers are attracted to the dark pigment.
So,
So that's what they're attracted to. That's what they see. So they don't see anything that's like clear, or which is a red hair kind of comes across as like a clear almost. It doesn't have the pigment throughout it.
So if I have blonde hair or gray hair, can I just dye it before I come in?
No, that does not work.
Because it has to be the melanin inside the hair shaft. Because
Yeah.
that's what draws energy down to the follicle, right?
Yes.
Okay, so it follows it all the way down.
Mm-hmm.
Does your hair have to be a certain length or grown out?
We actually want the hair short, like just a stubble above the skin. Anything more than that, you kind of waste the energy on what it follows down. and it just sees more of what is on the skin.
Okay.
And you run the chance of getting one less treatment effectiveness, but also you run the risk of getting a burn on your skin from that hair.
Oh, I wouldn't have thought of
Went
that.
in there.
Okay,
Mhm.
I was
great.
wondering about that as you were talking. I
Yeah,
didn't
that
really
makes
realize that
sense.
before.
Yeah, I've never even thought about that. Look at that. Look at that.
You learn something new every day.
I know. Teaching me. What would happen if I would, what if I waxed the day before or I used those hair removal creams?
So the hair's not in there it's pulled out. So it's not actually in there for the laser to be attracted to. So it doesn't even see that a hair lives there. So it would not be effective for you to have a treatment. You want to wait about 3 weeks.
For like waxing or hair
After
removal or
plucking,
tweezing. Yeah.
depilatory creams, any of that.
Yeah. I've had to put my tweezers behind glass so I wouldn't tweeze. Just, break in case of emergencies only. So it was tough. I was going to have a hair removal on my chin and lip and stuff. And because you have to shave it or clip it. I know. I know. The light is too. No. They're there. I need a touch up for sure. Or 2 or 3. And it, it's just, it feels weird at first to for women, I think it's more normalized now because a lot of women shave their vellus hair or their peach fuzz. But when I did it, 100 years ago, it was really weird. You just didn't hear about that happening.
And a lot of people still think, if I shave it, it's going to grow back thicker, coarser, but it's all hormonal. So if you shave it, it's not going to come back any thicker or coarser.
And actually tweezing hairs is what makes more hair
grow. It can stimulate more growth.
Because once you pull a hair out, then it stimulates hair follicles around the one you pulled out to become activated. And that's why people start tweezing one hair and pretty soon they're tweezing 100 hairs. Yeah. So,
yeah, I was just going to say, so you brought up hormones. Can you speak to a little bit about maybe like some hormonal influences on hair growth and some maybe special medical conditions that might affect laser hair removal?
So if you have PCOS or like HS, it really does help that getting that hair out of there. It does.
What is HS?
Oh,
HS.
I
can try to say it.
Okay, you try to say it.
Hidradenitis suppurativa is what I'm going to say.
That was perfect.
That was pretty good. I think
people that have it know it and can pronounce it easily,
or they know.
It's just
and a lot of people do refer to it as I have HS,
right? But it's just like your body makes like a bunch of little cysts, right? Like an overproduction of oils that clog pores, and then you can get ingrown hairs. It's really uncomfortable.
Yeah.
Very uncomfortable.
So
I don't have it, but it can be very uncomfortable for people.
So what were you saying about PCOS?
PCOS, polycystic ovarian syndrome. You can have treatment. It helps tremendously with that hair. A lot of people have extra hair on their face, and it's like a coarse hair most of the time, but it knocks that down at least for a little while, and you can go months even after you have that. Like if you normally you'll do a series of 6 to 8 treatments of hair removal, and then if you have PCOS, then you oftentimes will have to have more and more frequently. But it's more of a maintenance thing than someone that does not have PCOS.
Yeah.
It's still a maintenance. I mean, there's still maintenance treatments that you will have with hair removal, but it can be years between treatments.
So to begin with, what do you recommend for people, or what do you tell people to expect? First time laser hair removal person, I've never done it before. You've determined that my hair is dark. I'm a good candidate. How far apart, like if I was going to do my underarms, how far apart would I do those?
Most areas are 6 to 8 weeks apart. Anytime in that, it doesn't matter, depending on your schedule. But most areas you do 6 to 8 weeks apart for your best treatment. Then you have your treatments. There's usually about 6 to 8 to get a 95% reduction in most areas.
And it's not, for most people, it's not 100% permanent hair removal, right? Because like you said, our hair is hormonally influenced, so any
Yeah.
fluctuation is going to potentially cause some variation.
Yeah.
Pregnancy, breastfeeding, menopause.
Change in-
Perimenopause.
Yep. Change in
Stress,
medication.
right?
So-
Even stress.
I'm going to do
Stress
a
can
plug real
too.
quick right here. If you are struggling with any of those hormone things, come talk to me with our HRT program.
Good one.
So are there
Oh.
so who, we talked about who's a candidate. We talked about the different areas that can be treated. I mean, really any area. Length of time between treatments, how many are needed. Does that distance between treatments or number of treatments vary between areas that men will have versus women?
I've found through my years that you could do a safe treatment 6 weeks, but that
For
hair
a man, you mean?
for a back or chest,
Okay.
is those usually get spaced out further, like 10 to 12 weeks apart. I found works kind of better. You can do a safe treatment at 6 weeks if you choose to, but not all of the hair that's going to return is back by that time. It's kind of a slower.
So bang
So-
for your buck, it's better to go further apart.
Yes.
So
I found that.
we've been told by over the years that and we also were educated when we first started that women should have treatments 4 to 6 weeks apart. But we've learned through experience plus more education
Yeah.
that it's more beneficial to have them 6 to 8 weeks
Yeah.
apart, right? Because there's more, even the hair that's come back is hardier and
Mhm.
sturdier
Healthier.
and bigger
Yeah.
target for the next treatment.
Yeah. So the process
bang for your
is
buck, it's better to do it a little further apart.
Yeah. So the process is after your treatment, the exfoliation period is a couple weeks. So the hair will start exfoliating out within a couple days to a couple weeks. And then you kind of have a little break from it before that hair starts to come back. Not every hair will exfoliate out, maybe. Some will stick around, but most of it exfoliates out within that 2 weeks. And then it'll start coming back, usually around week 5-ish. So some will come back up sooner, but it's not if you wait a little longer, that the amount of hair that comes back is more and it's at a healthier state.
So
It's
your
been
next treatment
back
will be
more beneficial,
more effective. Okay.
Yeah.
And in between time, I shouldn't wax, I shouldn't tweeze, and I shouldn't use hair removal creams,
No,
but
just
I
shave.
can shave, and I should
Shave as often as you want.
Yeah.
You don't have
Okay.
to, besides right before your treatment.
like the day before.
Mhm.
Okay.
The day or two.
Okay. So what do I have to worry about afterwards? Can I just
Sun exposure,
Okay.
really heating your body
Right.
temperature up.
Like, could I go get in a hot tub?
No,
Sauna?
not for a couple days.
No sauna.
No saunas.
Okay.
Anything that's gonna
So what's
add
the risk if
friction,
I
horseback
friction.
riding,
Friction.
anything like
Friction.
that. Yeah.
I
Yep.
get you.
Uh-huh.
Anything
I
that's
got what
gonna
you're
add
laying down
friction.
there. Uh-huh.
Picking it
So
up.
what would happen if I went in the sun potentially? What could happen?
You could get dark pigmentation bars. They're usually temporary. You could get blisters. But
So-
those dark pigmentation, it's usually temporary, but like 2 to 6 months. So it's not
Yeah, you
something
don't
you
want
want for 2
So
to 6 months.
could I maybe get a blister anyway, even if I don't go in the sun?
It's possible. I
Because
mean,
we
it
don't
is
really have any
possible, but
control over how much energy your skin pulls in from one pulse to
Mhm.
the next, right? It can be just kind of random. Like I didn't change the energies, but
right. It
but
can
that's
just be one
not
little-
very common.
No,
Yeah.
not common.
Not very
Very
common
common.
at all. And also you could get some hyperpigmented just from like not even being in the sun, but going into a hot tub or getting overly heated, right?
Hormones.
A little
Your
hormone
hormones
surge,
can add.
like a
You
hot
can
flash.
get hyperpigmentation.
Okay.
Um,
Who, besides people who don't have pigment in their hair, like blonde, white, gray, or red, who would not be a candidate for hair removal?
Someone that's freshly been tanning is you just
sunburn.
really right, or sunburn. You just really don't get your most effective treatment and your safest treatment
Because
you have to lower the energy so much, and you just have to be so careful that you don't get a good, an effective treatment. I don't find that it's worth even the risk of doing a treatment.
Yeah. And
it's
she
just
doesn't
risky, and
she doesn't really sleep that well anymore anyway, and she doesn't want to stay awake worrying about.
And I do.
Yeah.
I will.
Yeah. So she always is as safe as she'll turn somebody away before she'll risk.
Yeah.
Yeah.
It's not worth it.
Mm-mm.
It's just
No.
not.
Gosh, what else? Anything else? So if somebody's pregnant, can they have hair removal?
No.
I just thought of that as special medical conditions.
Oh, yes.
Yeah.
No pregnancy. You can do it like if you're breastfeeding, it won't affect any. It won't affect your supply or anything, but your hormones are still kind of woohoo.
Mm-hmm.
So you don't always get as effective treatment.
Okay.
Out of it.
What about a teenager?
Teenagers, I do treat teenagers, like sometimes their hormones are still like not completely balanced, especially I don't like to treat them if they haven't had their period yet, usually about a year or so after. But they might have to have treatments. They most likely will have to have treatments, maybe a whole full series later on in their life.
Yeah. And sometimes with teens, you found that after a couple treatments, it just doesn't seem like it, even though they appear to be a good candidate, it just isn't doing anything. And you advise them to wait, right?
Yeah.
For a couple years. Okay. All right. Well,
or if it's worth it for them to get that
thinning,
little bit of time between, more than like waxing or something like that, then you can do it. Choice. But that's up to you to decide whether it is worth it for you, knowing that you're not getting any real permanent reduction at that point.
Because even though like some of my hairs on my chin are white and gray, it still knocks them back.
It does stun them a little bit.
It stuns them for weeks.
Yeah.
And so even though I know those hairs aren't going to be gone or affected in a permanent way or more permanent way, I still really like having that done because it knocks them back. So that it's worth it for me for that reason.
Yeah.
Before they leave, I just wanted to thank our live studio audience today. So if they can give themselves a round of applause, I appreciate them being here.
So we're going to give our little obsessions of the week, of the month, or the half year.
Oh yeah. You know what's funny is
gotta be a way to be free.
So we'll have to come up with something on the
spot. So yesterday we had our L-Therapy rep come
Thank you,
in,
Skylar.
and they have some new protocols and they have some new treatments, and I know one of the things that kind of is known or reported about L-Therapy is its discomfort, and one of the newer treatments they have, and we'll talk about this a little more detail in another episode, but it's just kind of one level, and so it's kind of the lateral here and
the chin
anterior
strap.
Lateral, and so it's only one level, and it's very doable and really quick, and we're gonna
did we all do it yesterday?
Some of that.
I did.
You did?
We're going to be combining, I have a hair in my face, I'm so sorry, but we're going to be combining that with some other treatments and doing some combined.
I got a gal that can get rid of that for you.
Yeah. And so that's my little obsession, is my new love and appreciation.
Can I have the same obsession? Because I want the same.
Yeah.
I have the same.
And then,
Skylar, if you're watching this.
And my product obsession is Retin-A. I love our Retin-A here. It's a 0.05% and it's combined with niacinamide. I absolutely love it. and I just love it's so tolerable to use for Retin-A and turning over the skin cells, and everybody should be on Retin-A. Just, for skin health.
Just about everybody.
I think you should talk about the hypercator.
I think I will, but are we gonna do professional first, and then you're gonna do your personal one? Because you kind of just gave two professional ones.
Yeah. My personal one is what I use at home. That's why I did the treadmill.
Okay. Mm-hmm.
That was my personal one.
Not that it's been so long that you forgot how this works.
No, that was my personal one.
Mm-hmm. Believe you. Okay, so I got a new toy and I'm super excited. Stick to it. So I got a new machine called the Hyfricator, and so Sharon and I are gonna have a little fun one day. Maybe we should film that. Yeah, that'll be fun. So it's an electric cautery device, and so I'm gonna zap her with a little
to remove
all kinds of things. Okay. So we can do skin tags with that. We can do gosh, I have like a whole list in there. Yes, SKs. You can use it for little broken vessels, little like cherry angiomas. Thank you. I
have plenty of those.
Gosh, I mean, we're gonna have some fun. It's fun. It's very tolerable. It's quick. It's easy. So I've had a lot of people. Oh, and one of the reasons that we got it was for my brain does not work today. So I'm going to defer to you to help me remember the
seborrheic hyperplasia.
There you go. Because I'm pointing right here because I've got like 3 of them that I need somebody else to do for me. What else? Okay, we're gonna play charades here. Ready? Yeah. So it does a lot of things and more than that too. But we're gonna. I'll practice on them before, and get real type
perfect.
Yeah. I've used it many years ago, but it's been a while. So I'm refreshing myself on that. Yeah, so coming soon. So that'll be fun. We've just had so many people, lately being like, what is this little bump over here? Or, it kind of is like a little zip, but then I play with it and maybe something comes out, but then maybe nothing. And it's just
causing more trauma.
And and they're so annoying. They're difficult to get rid of. So that's something that we will be offering very soon, so watch for that. Okay,
she did the L-therapy also.
Yeah,
that's cheating.
I don't think so.
Oh,
I don't think it's cheating at all.
Mm-hmm. Brought to you by
thank you, Skylar.
The letter U.
She gets a guest host pass.
Fine, not next time. Next time I'm gonna call on you in the studio audience and be like, Joelle, you're up. Gosh, and now I've had this whole time and I was listening to you guys so intently that I wasn't thinking about myself. That's my professional obsession is the Hyfricator. My personal one is that the sun came out today and we are melting snow out there at a rapid pace. I saw the roads steaming yesterday when it was still even
3.
Yeah, 3 degrees, but we were in the positives, so that was good. Right. And it's so sunny, so I'm gonna go.
We'll find her on top of the one little snow hill out here.
Yeah, rolling around, making snow angels, enjoying the sun. So yeah,
getting a little warm.
Wear your sunscreen.
Always, Joelle. Always, Joellen.
Okay. All right. Well, we have taken up 25 minutes of your time once again when we were going to shoot for 15.
That's how it happens.
Thanks for listening. We appreciate everybody. Please leave a comment.
I'm gonna cut her off. Special thanks to our. Wait, no, I'm not done. Special thanks to our guest today, Joelle, laser tech extraordinaire. If you need anything, we got a girl for that. So anyway, thank you for tuning in today, and we will see you next time.